So we have some really sad news to bring you this morning. An incoming Republican member of Congress, Luke Letlow, has died of coronavirus. Only 41 years old. He's survived by his wife, two little kids, 3 years old and 11 months old. I mean, what a tragic story. And I mean, of course, Rachel, just a microcosm of the tragedies that have been unfolding by the thousands across this country every single day. And we are still in the worst of it.
Yeah, really, really sad story. Luke Letlow, well known around Washington, D.C., is a former Republican Senate staffer. And, you know, our hearts go out to his family. You can't even imagine what his family is dealing with. And to your point, thousands across America. And it just, you know, COVID is still a very real disease. I think we're learning more about it every day, but it's still something we didn't know about a year ago. And so I think this just goes to show that hopefully, you know, this year will end and we will get through this and these kind of stories will diminish.
Yeah, but this is, I mean, this just shows again, underscores for one more time that this is something to be taken incredibly seriously. I mean, we had, I'm just looking at the numbers now, 200,000 new cases yesterday, 3,628 deaths. And yes, we can throw this up on the screen from Bloomberg. Yes, the vaccinations are starting to go out, more than 5.1 million shots given. You may say, okay, well, that sounds pretty good, like we're headed in the right direction. But actually, we are way behind the schedule that the administration had originally laid out. They were planning on having 20 million vaccinations administered by the end of the year. I don't have to tell you the end of the year is just a few days away. CNN actually had an expert on yesterday to lay out the math of, okay, if we continue at this pace, how long is it ultimately going to take us to get to herd immunity? Let's take a listen to what she had to say.
The speed, 2 million in 2 weeks sounds really impressive, but I did some back of the envelope calculations here. And at that rate for a 2-dose vaccine, for us to reach 80% herd immunity in the U.S. through vaccination, it will take us 10 years at a rate of 1 million vaccines a week. Or put in a different way, if we want to get there within 6 months, we need to be doing 3.5 million vaccinations a day, not 1 million a week.
Long lay the world in sin and ever pining, till he appeared and the soul felt his word. A thrill of hope, the weary world rejoices, for yonder breaks a new and glorious morn. Fall on your knees. Oh, hear the angels' voices. Oh, night divine. Oh, night when Christ was born. Oh, night divine. Oh, night when Christ was born.
Frustrated and disheartened.
Joshua Matchett says the news from Tender Care Living Center isn't surprising, and he worries for families dealing with the stress. Matchett's father died in April at his long-term care facility in Georgetown, Ontario. Residents are supposed to be checked hourly, but his body was only discovered 6 hours later. An inspector's report concluded the home, quote, failed to protect Travin Matchett from neglect by staff.
It seems that, elderly citizens are no longer a productive part of society, so we can just put them under a rug.
A sentiment echoed by those in the field.
We're going to have catastrophe and carnage within the second wave of COVID-19 in long-term care homes.
This summer, the commission into Ontario's long-term care facilities heard brutal testimony from residents and healthcare workers about shortages of staff, proper protective equipment, and appropriate oversight, problems which persist to this day.
We should not be having homes where you're having dozens of deaths inside a long-term care home this far into the pandemic. It's unacceptable and it's unforgivable.
They certainly could have rapidly started to recruit and train people to work in long-term care.
This sociologist points to Quebec, where a recruitment campaign for orderlies was launched in May. Almost 7,000 additional orderlies are now working in homes across the province. But Ontario's recruitment efforts seem stalled. Now there are calls for the Army to step in.
They need to be there as long as we see incidences of neglect and rapidly rising infection and death rates.
But the Army needs to be invited.
Deployments of the Canadian Armed Forces or of the Red Cross is always done at the request of the provinces in question.
Ontario's Solicitor General confirms no request for the Army has been made, at least for now.
Across a pandemic-ravaged nation tonight, reality sinking in. Help from Washington isn't on the way. Grandmother Nicole Akers in Wilkes-Barre, Pennsylvania, is staring down her last week of unemployment.
The panic mode has now kicked in. You know, my unemployment is not a whole, it's not a heck of a lot, but it's gotten us by. But this now is going to be a real struggle.
Today, 2 federal unemployment insurance programs that would have been extended in the relief bill now expire.
The Americans are getting hit with unexpected medical bills after they were hospitalized with the virus, and many are already dealing with furloughs and layoffs caused by the pandemic. Brian Calfano has that.
The federal government's COVID relief funding program provides for a series of services related to public testing and supplying healthcare workers with needed resources to treat the sick. But aside from swab and saliva tests and PPE, just what the government covers in dealing with this pandemic is a bit hazy. So let's break it down to help you avoid some unexpected bills. If you have insurance and are hospitalized for COVID, are you covered? Well, according to Nisha Karani at the Kaiser Family Foundation, it depends.
Whether an individual's, the cost for COVID-19 treatment, if they are hospitalized, is covered, really comes down to what the insurance company has decided.
The best bet, if you're insured, is to ask about your plan's COVID coverage for hospitalization costs, and do so before you end up in a hospital care situation. Depending on your plan, you may need to work with your insurance company to get it to pay for certain treatments. As with many insurance decisions, costs can be a factor. For example, it costs a lot more to put a COVID patient on a ventilator and supply remdesivir. The drug originally developed for hepatitis, doctors have emergency FDA authorization to use on COVID patients. So depending on the level of care you need, your insurance may only pay for part of the costs. But what if you don't have insurance at all? That answer seems less complicated, at least on the surface.
The legislation passed earlier this year in 2020 does provide hospitals and providers with funding for treating, for the cost of treating uninsured individuals for COVID-19.
It sounds like people without insurance needing COVID treatment paid for are in good shape. But we received this statement from the Department of Health and Human Services. Quote, reimbursement under the uninsured program will be made for qualifying testing for COVID-19, for treatment services with a primary COVID-19 diagnosis, and for qualifying COVID-19 vaccine administration fees. So notice the qualification language from HHS. Eligibility for the government's uninsured program requires a primary COVID-19 diagnosis. This makes sense, but it also may make things complicated for some. Since the CDC calculates the COVID death rate to include so-called comorbidities, that is, multiple contributing factors to death, it makes sense that people presenting in emergency rooms for inpatient care may have multiple ailments needing treatment, including COVID. But if doctors do not consider COVID the primary diagnosis for a patient, COVID treatment for that uninsured is not covered.
You're checking their list twice. Holiday shoppers streamed into shops in Union Square, some waiting in lines, and some others did pretty well. At least that's according to Betty Yu, who was in the thick of it all tonight.
Tonight it was far less crowded here in Union Square than what it would normally be during Christmas Eve. Still, shoppers hit those stores, taking advantage of the final few hours before Christmas. They came for festive photos, for last-minute gifts, and to get out of the house.
It was busy. It was real busy. I had to wait in a long line.
In the end, Murray says she got what she came for, presents for her 3 children. Why not just buy it online? Because we're in a pandemic, why risk going out?
Well, I like going outside. And then during the whole pandemic, I've been in the house with them. So it's always a good experience to get some fresh air.
There were plenty of people doing just that in Union Square this Christmas Eve. Under the stay-at-home order, retail stores can operate at 20% capacity.
Just some cologne, you can't see it in there, some sweat, some pajama pants.
Lafayette Bickham scored these deals without waiting in any lines.
Normally the city, I'm from here, so normally the city is busy, and I like how Union Square is, and so I'm kind of missing out on that. I didn't realize I was.
Andrew Wiles works at the Adidas store at Westfield Mall, where there was only a moderate line throughout the day.
I would say the previous holidays were more hectic because we have more tourists coming in. So a lot of people would spend the holidays in San Francisco, so we'd have more people from out of the country.
Pandemic or not, procrastinators found themselves in a familiar place.
Because we are too disorganized, some of us, so it's just last minute, and you want to surprise someone for Christmas.
Santa Ana has more COVID cases than any other place in Orange County, yet testing for some of the most vulnerable people has just become more difficult to access. Funding to operate the largest free testing site at Santa Ana College ran dry this past Sunday.
It really couldn't have ended at a worse time, because that's really the point in which we're seeing a lot more need for testing. We're seeing our residents that are looking for testing sites, that are looking for resources.
More than $30 million in CARES Act funding for COVID relief programs, including testing in Santa Ana, had to be spent by the end of the year. But the ongoing need in this city, according to officials, isn't matching the funding. There are super sites in Costa Mesa and Anaheim where people can be tested. Reservations are needed, though, and for those who don't live close, it's a major challenge to get here.
It's a concern because Santa Ana employees work in all cities in Orange County, and if they can't get tested, then they might be going to work sick.
The nonprofit Latino Health Access is continuing its testing clinics in Orange County's most impacted cities, in Santa Ana and Anaheim. But Santa Ana's mayor is upset that essential workers in his city have fewer options when they need it most.
What makes most sense to me is that there should have been more investment by the county and the state in areas like Santa Ana, where we really are the epicenter in the county of where the need is. And so, we have 5 of the highest zip codes in the county. So it should have been, I think, better thought out to say, let's put a testing site or resources in the city where the need is the highest in the county.
Dozens of Orange County nurses at several area hospitals walked off the job this morning to protest the new state staffing mandates.
It's a pretty scary place in there right now, to be perfectly honest. There's a lot of really sick patients and we're short-staffed.
So we're asking for safer patient ratios, safety for our nurses, and more protective equipment.
So they're protesting the effects of a new waiver recently granted to hospitals by the California Department of Public Health. They say it uses the pandemic to roll back safety staffing standards in the state, which puts the lives of patients, nurses, and other healthcare workers at risk. Their hope is that the walkout will send a message to Governor Newsom regarding the resources needed to provide safe patient care.
And we've seen a 40% increase in cases in England in the last week alone, almost 15% more patients in hospital, more than at the peak of the first wave. And yesterday, sadly, we recorded almost 1,000 deaths across the UK for the first time since April. So at this critical moment, with the prospect of freedom within reach, we've got to redouble our efforts to contain the virus. And that's why the Health Secretary has announced that more areas of England will be moving into Tier 4 from tomorrow. And I say again, no one regrets these measures more bitterly than I do, but we must take firm action now. In secondary schools, all vulnerable children and the children of critical workers will go back next week across England as originally planned. But we will ask exam year pupils in secondary schools to learn remotely during the first week of term and return to the classroom from 11th of January. The remaining secondary school pupils, i.e. non-exam groups, will go back a week later. That is from the 18th of January. I must ask you to follow the rules where you live tomorrow night and see in the new year safely at home. That means not meeting up with friends or family indoors unless they're in the same household or support bubble, and avoiding large gatherings of any kind. I think the best answer I can give at the moment is that we will have millions of doses, tens of millions of doses by the end of March. We're working to get the programme going as fast as we can. I don't want to give you specific numbers at the moment, but I can tell you that we are shifting heaven and earth to roll them out as fast as we can.
This was a brand new Terry production 2020.